I'd like to wish you a very good morning, aloha, and welcome to Sunday morning here on Community Matters, a public service program produced and presented by this iHeartMedia radio station. Good morning, everyone. My name is Rick Hamada, your host. There's no doubt about it, in light of Super Bowl Sunday last week, that the conversation and the topic of brain injury, concussion, etc., has been top of mind all season long and for a couple of years in the NFL, but also in our own communities. And we're blessed today to have a conversation about rehabilitation, about research, and how our community can help one another in many different ways. To help us understand all of this, we have a great panel in studio today. Joining us is Dr. Violet Horvath, who is the director of the Pacific Basin Rehabilitation Research and Training Center, part of the John A. Burns School of Medicine. And Violet, we wish you a good morning. Thanks for being with us.
Aloha. Thank you for having us.
We have a great team of guests today, don't we?
We do. Excellent.
All right. We're going to jump in just a moment. But first, we want to learn more about Violet. Would you mind sharing some information about yourself, please?
Certainly. As you mentioned, my name is Dr. Violet Horvath, and the most important thing is that I'm director of the Pacific Basin Rehabilitation Research and Training Center, which unfortunately most people don't know about, but we've actually been around for 30 years.
Oh, my.
Yeah, we work with all kinds of people who have all kinds of disabilities.
Mm-hmm. And how was it established going back so long?
Dr. Sotaro Izutsu was one of the persons who co-established it. He's still at the John A. Burns School of Medicine, and it was initially meant to help train individuals to work in the Pacific Basin with people who had disabilities, and it's just grown from there.
Does it run the entire spectrum of disability? Or
Absolutely.
Is there a focus? Entire spectrum?
Absolutely.
Okay. One of the things we'd like to know, and that is there is a project that is underway that is vitally important. Can you share with us, please?
Yes, and this is one of our projects, which is the Hawaii Neurotrauma Registry project. And we are funded by the Hawaii State Department of Health, and I have to really commend them for having the foresight to do this, and I really mean it. They're trying to look into the future. We have a lot of information about people who have stroke, traumatic brain injury, or spinal cord injury when they're in the hospital, when they're at the rehabilitation facility, but we really lack information as to what happens once they leave those facilities. Mm-hmm. That's the missing piece. And so with this project, we're trying to understand, this is for all Hawaii residents of any age who had a stroke, traumatic brain injury, or spinal cord injury at any time. What services do they need? What problems are they encountering once they get back home?
Is there speculation as of right now of what those numbers and or conditions may be without the project?
A little bit. Mm-hmm. It's vague. You know,
right.
For example, we know a lot of individuals with traumatic brain injury have difficulty finding jobs and keeping jobs. Also, depending on what type of stroke they've had, how severe it is, what the long-lasting effects are. Employment is a big thing, but it could be anything. It could be housing. It could be social skills. They just need someone, a companion. They need someone to help them with shopping and cleaning. Honestly, it runs the spectrum.
In that case, if there are folks who are interested that would like to participate, how's the outreach and how can folks jump on in?
There are several things that we do. If individuals would like to participate in the registry, they can go directly to our website, which is www.HNTRsurvey.com, or call us at 808-692-1375. We can assist them with the survey, but we also do information referrals. For anyone who's had one of these injuries, whether they choose to be in the registry or not, we can provide them personalized information and referrals. We also go out and educate the public about these neurotrauma injuries.
Excellent. Dr. Violet, thanks for that. We're going to come back and chat with you in a moment, if you don't mind. Also welcoming into studio is Dr. Robert Sloan. And Doctor, first of all, thanks for being with us. Hope things are going well for you as well.
Thank you very much for having me.
Would you mind sharing a bit about yourself, please?
Sure. I'm a physiatrist. A physiatrist is a specialist in physical medicine and rehabilitation, and kind of like a neurologic orthopedist, kind of a mixture of things. And I'm the founder of Hawaii Concussion Care Centers and also the current president of the Hawaii Medical Association.
When we talk about traumatic brain injury. What's the distinction between perhaps that and what we all are familiar with, which are concussions?
A concussion is just a less severe traumatic brain injury. So a concussion is a brain injury. Traumatic brain injury can include more severe injuries, including bleeding in the brain, bruises in the brain, skull fractures that cause brain injury underneath.
Right.
A concussion is usually thought of as a less severe form of brain injury. It's usually temporary. Usually the symptoms go away in 10 days to 3 weeks. It's considered to be a derangement of the brain nervous system function that in past we thought was without any permanent sequelae, but now we know that even mild concussions, even what we call subconcussive blows, which are concussions without symptoms, they can lead to permanent brain injury, and this can accumulate over time.
What is the causation for concussions? And maybe I can back up a little bit. In determining the severity of a concussion, what's the methodology for doing that?
Well, we used to have grading systems, but we don't really use those anymore.
Okay.
Those were based on whether you had loss of consciousness, which is a more severe concussion, or whether you had post-traumatic amnesia and other symptoms. But any concussion is serious, and those grading systems aren't used that much anymore. But if you're unconscious for any length of time, the longer you're unconscious, usually the worse outcome.
Right. Traumatic brain injury, very frightening to consider. Is there a common source here in Hawaii more than others, or how does one suffer from that?
Some of the common causes are falls. This can include falling out of your lychee or mango tree, falling downstairs. In our elderly, it's common if they have throw rugs around the house or wires, right, and they trip over them. Of course, I'm very interested from the concussion standpoint in sports. Recently, football's been in the news, boxing is in the news. Mm-hmm. We've known about the results of prolonged concussions for years. We've known about it in boxing as pugilistic Parkinsonism or punch-drunk syndrome. We've known about it in other sports. Now football is really big, but actually here in Hawaii we're seeing it in many sports. Recently, girls judo had a very high incidence of concussion that we're concerned about. Wrestling, other sports, even basketball, volleyball, they can also have a concussion incidence that we need to pay more attention to.
I've seen, my son plays basketball, he's 14, but at school, and there were a couple players, they were battling for the ball, and sure enough, they knocked heads. Both were sprawled on the floor, and some were going, oh yeah, I'm okay. I'm thinking to myself, brother, you better get yourself checked out, because anytime you have that kind of a impact, there's got to be some sort of associative effect.
Yes.
Oof. Super Bowl this past weekend, last week, of course, pardon me for the tears flow for the loss of the Seahawks, but I think it was Edelman on the Patriots that he got tuned pretty well, and we're all looking at that hit going, is he going to get back? I mean, would he? Can you give us an idea from your perspective of what transpired, which is a fairly common occurrence in the NFL?
Yeah, this is really interesting. The NFL have changed their rules and are really trying to protect the athletes more against concussions because of the controversy, and it just makes sense. You want to protect your income, your main players. All the players need to be protected. So they have a new concussion protocol that not only includes the team doctors, which didn't work out very well in the past, but includes doctors who are unaffiliated and trainers that are unaffiliated. So he got evaluated on the sideline, and though we all thought he had a concussion, they didn't find any signs of that. The concussion protocol that they use is not perfect, and so far they're not using the newest one that we think might be better and quicker on the sideline, which is called the King-Devitt test. Which is a visual test that seems to be more sensitive, and not exactly clear why they're not using that yet, but it's being vetted, and it seems to have a lot of promise as a really good test. But there was the other player, Cliff Averill, who did get pulled out. Mm-hmm. So, it depends partially on who's doing the testing. It might depend on the level of game that's involved and the player. But when they did the tests, multiple evaluators determined that he wasn't suffering from the current signs and symptoms of a concussion. And symptoms are one thing, because an athlete can say, hey, I feel fine, let me go back in. But the signs that we're looking for, we check for concentration, we check for eye movement, a lot of different neurologic issues, orientation, recall, memory, that kind of thing. Those were all normal. And so the decision was that he was fine to go back in. And obviously, he did really well. He had the winning touchdown.
Yes, he did.
Doctor, CTE is something that we hear quite a bit about as well. CTE would be?
Chronic traumatic encephalopathy. That's the new name. Actually, it's been around for many, many years, but it's really big in the news now. That's what was originally causing punch-drunk syndrome in the boxers. We found it in steeplechase players. Now we're finding it in football. We've even found it in baseball players and wrestlers and other athletes. Chronic traumatic encephalopathy is a neurologic progressive degenerative disease of the brain that causes athletes later in life to have problems with impulse control, depression, memory, and can lead them to be so depressed that they might commit suicide.
Junior Seau comes to mind.
Exactly.
Tragic. There's a lot of this in the news. I just watched another special on HBO with Brian Gumbel on sports, and they took a look at the 1985 Super Bowl champion Chicago Bears. As a Bears fan, I'm going, wow, we have a special on the Bears, the greatest season ever. It was a devastating expose of the conditions that most of the players of that era are suffering from today. And it appears that that's exactly what you're describing is what many are suffering from now.
Yeah, Frontline had a great 2-hour show called League of Denial about the NFL, and a lot of these athletes are already suffering from this. There is that might be that only 10 or 15% of them will get the real severe form, and we're trying to figure out who those players are and what to do about it.
Yeah. As a parent, I would want to avoid, and prayerfully my children would never suffer from a traumatic brain injury or anything even close to it. Couple things. One, prevention. Two is almost a self-diagnosis. What should we have as parents and or individuals as that signal or flag to say, you better get something, you better get yourself to the ER or to your physician?
Well, usually you'll see the impact or somebody will report it to you, and you just need to be sure that your athlete doesn't have a headache, doesn't have any symptoms like dizziness or memory problems. Mm-hmm. And you evaluate them on the field to be sure whether they're okay. The best way to handle these problems, if you know that there was a concussion, is to pull them from the game and keep them from playing until they're normal again, until they're neurologically intact. And that includes symptoms. They have to say, oh, yeah, I feel, much better. I don't have any symptoms. And the signs that we're looking for, which are often best determined with neuropsychological testing. Here in Hawaii, at the high school level, every athlete's having pre-participation neuropsych testing called impact testing. Mm-hmm. And then after a concussion, we give it to them again to determine whether they're actually not doing as well as they were before the concussion. And as soon as they recover and all the testing is back to normal, then there's a 6-day return-to-play protocol that includes conditioning, strengthening, and determining whether you can elicit what we call provocative symptoms. So you may feel fine, your test may be normal, but then we run you really hard or have you do some hard push-ups and you get a headache. That's a bad sign you're not ready to go back yet. Nobody should go back to play until they're asymptomatic and normal neurologic function. And right now, it's generally accepted that no children under 12 years old should play contact sports at all.
I was just going to ask the question before we transition. Would you let your son play football?
I would let him play flag football, but not contact football. In fact, I may not allow them to play contact football at any age.
Understand. Spinal cord injuries. If we could briefly, you could explain a little bit about the prevalence, causation, and the effects. Spinal cord injuries, fairly common.
Well, not nearly as common as brain injuries. In fact, one of the things we're doing is trying to determine how many brain injuries are occurring. and that includes the subconcussive blows, which are very important. But spinal cord injury is very important. I've actually taken care of a lot of spinal cord injured patients. The causes run the gamut. Falls again, motor vehicle accidents, which also can cause brain injuries, and sports here in Hawaii. Remember that spearing was outlawed back in the 70s, and that was to prevent neck injuries, and now we're more concerned about the brain. But the neck is very important. And ocean sports here in Hawaii, very important. Sandy's has a whole lot of spine injuries because of going over the falls, hitting the sand with your head. And that brings up a good point. If somebody gets a concussion, you have to assume a spinal cord injury, a neck injury. Usually, if they're unconscious, you can't find out if their neck hurts, so you have to assume they had a neck injury, and they are highly associated. If you've had a neck injury, you also have to assume there was a concussion at the same time.
Understand. Dr. Robert Sloan, awesome. Thank you so very much for the contribution.
There is one more thing I'd like to mention about spinal cord injuries in 20 seconds. Surfer's myelopathy is a really big thing right now. That's a spinal cord injury from surfing, and we have the highest incidence here in Hawaii. It's not very common, but it's devastating, and it's just from laying on the board for too long, usually in beginners who have never surfed before, and they actually get a spinal cord injury from not changing position, probably from a blood flow problem to the spinal cord. And it's very subtle and hard to diagnose and very dangerous. You shouldn't be out there on your tummy paddling the board for more than an hour without sitting up or paddling in and resting.
Never would have known that unless you just mentioned it. Thanks for that very much.
You're welcome.
Thank you very much indeed. You're dialed into this edition of Community Matters, public service program produced and presented by this iHeartMedia radio program. And my name is Rick Hamada, your host. We welcome in Dr. Matthew Koenig. And Dr. Koenig, good to see you in studio today. How's everything with you?
Very good. Thanks for having me on the show, Rick.
As with everyone, would you mind telling us about yourself?
Sure, no problem. So I'm a neurologist at the Queens Medical Center, and I specialize in stroke and intensive care. Stroke and intensive care. Strokes we hear about all the time on a regular basis, yes? That's right.
Yeah. Your foray into medicine, how did it begin?
I went to medical school at University of Maryland and then did most of my training at Johns Hopkins in Baltimore. Wonderful. And I moved out here to Hawaii about almost 6 years ago at this point.
Excellent, excellent. Johns Hopkins, remarkable. I have a friend of mine who studied there as well. The association between traumatic brain injury that we just talked about with Dr. Sloan and also with stroke, is there a correlation?
There is a correlation, and those are two diseases that I treat as a critical care doctor who takes care of patients with complex brain and spinal cord injuries. Most of what I do for a living is take care of patients who have strokes of various kinds or traumatic brain injuries. Mm-hmm. There is some interrelation between the two in that people who have had recurrent traumatic brain injuries are at higher risk of stroke, and that's a relationship that we're just now beginning to figure out.
Understand. I also, as part of your responsibilities, the medical director of telehealth. Can you tell us what telehealth is?
Sure, no problem. Telehealth is kind of the new term for telemedicine. It's a more encompassing term. And telemedicine really means the ability to see patients remotely using two-way audiovisual telecommunications. You know, for instance, I can log on to a website and see a patient who's at Hilo Medical Center, for example, in real time, and that person can also see me, and we can talk to each other. And you can actually do some physical examination as you would with a live patient.
I bet that's been a boon. That's been such an advantage to be able to help more people, yes?
It's a huge thing for Hawaii, and it makes a lot of sense for the geography that we have.
Strokes. I know I'm concerned at my age, which is 23. But it is, it's a condition that we would all do our best to prevent. First of all, technically and briefly, what is a stroke, and what is the average age for strokes?
Okay, thanks for that question, because I think everybody has heard the term stroke, and they have some idea of what a stroke is, but there's a lot of confusion about it, and I get asked a lot of questions about stroke. And so first of all, stroke is different from heart attack, okay? A lot of people use those terms interchangeably. Mm-hmm. So stroke is basically like a heart attack of the brain. Heart attack occurs when there's blockage of blood flow to the heart. A stroke occurs when there's blockage of blood flow to the brain.
Gotcha. Average age, how can we determine average age of stroke victims?
Stroke is mostly a disease of older people, people in their 60s and 70s, but it really spans the gamut of ages here in Hawaii and nationally as well.
I've heard of, very young people that have suffered strokes.
That's right. There are quite a large number of people in their 30s and 40s who have strokes.
The association with high blood pressure, what is that relationship?
There's a very strong relationship between high blood pressure and stroke. In fact, when I'm teaching medical students about stroke, one of my key slides is to say that stroke is a disease of hypertension. Hypertension is high blood pressure. And so the major way of preventing a stroke is by treating high blood pressure. And that's why high blood pressure is termed the silent killer. Because patients or people just in the general public who have high blood pressure, maybe even young people with high blood pressure, they don't have any symptoms. It's not like it really causes headache or feeling really anything. And so unless you check your blood pressure, you don't know that it's high.
Just very briefly, I believe it's called TIM, T-I-M, is when you have this, I had this like rush of sensation in the top of my head one day.
TIA,
yeah. Thank you. And so so as soon as I was off the air, went to the ER, sure enough, it was not, but it's that type of a signal that will compel someone like me to, let's take care of this. What are some of the other signs that we can look for, and how can you tell if somebody is actually having a stroke?
Thanks for sharing that story, Rick. That's really important. So TIA stands for transient ischemic attack, and a lot of people refer to that as a mini stroke or warning sign for a stroke. And what we know is only about 10% of people who have strokes have actually had a TIA in the past. So it's actually not common to have any warning sign at all. Mm-hmm. What's important is to do what you just said, which is even if so let's say you have symptoms of stroke, and we can talk about what those are. You mentioned an important one, which is numbness or sensory changes on one side of the body. Mm-hmm. That can certainly be a sign of stroke or TIA. And so what's important is not to blow off that symptom, to seek medical attention for it, even if it resolves.
Right. Boy, it's such a heady topic, and I know that, no pun intended, that was so bad, but it resonates with a lot of our listeners because the curiosity. If folks would like to learn more about strokes, treatment, prevention, etc., what would you recommend they do?
I think the American Heart Association is really the go-to source of information on stroke, and so that would be heart.org or AHA.org.
Okay, we'll do that, without a doubt. Dr. Matthew Koenig joining us. Thank you very much again.
Thanks so much.
Thank you so much. You are dialed into Community Matters, public service program produced and presented by this iHeartMedia radio station. Violet, I want to come to you for a moment, if you don't mind, Violet, and then kind of give us your brief overview of what we've experienced so far, and then we have a special guest in studio.
Yes, I want to thank both Dr. Sloan and Dr. Koenig. They are experts in their respective fields, and I want to thank them for taking time out. They've presented some tremendous information. And so, as we talked at the beginning of the program, we're here representing the Hawaii Neurotrauma Registry project, a project funded by the State Department of Health for any Hawaii resident of any age who's had a stroke, traumatic brain injury, or spinal cord injury. And we're chiefly interested in what happens after they leave the hospital or the rehabilitation facility. And we also do information and referrals and education for the public. www.hntRsurvey.com, or please call us at 808-692-1375.
And would you like to introduce Colin?
I would.
For us today?
We have Colin Whitehead with us, who has had, unfortunately, multiple concussions, and he is our Deaf and Hard of Hearing project specialist at Pacific Basin Rehabilitation Research and Training Center. So he's going to share his story today.
We appreciate it, Colin. Welcome to the program. Good morning.
Thank you. Nice to be here.
As with others, can you share just a bit about yourself, please?
Yeah, I work for PBROTC, as Violet mentioned, as their Deaf and Hard of Hearing specialist. I'm here this morning not in that capacity, but as a survivor of multiple concussions.
About how many concussions did you suffer?
Diagnosed, recorded, 6.
Oh,
but
my
I probably
goodness.
had more when I was younger, playing Pop Warner football or just roughhousing.
And later on in life, as a young adult, same thing, was sports related, or?
My first one was a severe one that occurred playing football. I was 16.
Wow.
When I had that concussion, my season was over, just like that. There was no question about it. A week later, it was our homecoming. I'm on the field, not going to play, but I'm going through warm-ups, helping the teammates get ready. Our kicker kicks the ball right in my noggin.
Oh.
I still hadn't recovered from the symptoms of that first concussion, and I had a second one.
Wow.
So after that, my football career was over, but my first love was basketball. So I wasn't going to stop playing sports. But, you know, like you mentioned, your son, he plays basketball, and you see how your head gets banged around a lot. So I had 4 more. I actually went to a small college, Gallaudet University, to play NCAA basketball. My 6th concussion occurred 2 days before our first game. And the doctor said, you got to stop. So that was it. In one fell swoop.
Unbelievable. What time period, what years are we talking here? How long ago has this been, Colin?
So it's been about 6 years since my the last one. So I was 19 when I suffered my final concussion.
And that was for sports?
Sports. All sports.
Oh man, you love sports too, don't you? I can see it, man.
Yeah, I'm from Indiana, so you know basketball is like a religion out there. So it was difficult.
Brother, I grew up in a small town, Valparaiso, Indiana, and you get Indiana and Kentucky together, man. You scrap it up.
You know, we got a good contingent of Hoosiers here. I'm from Indiana. Bob next to me is from Indiana as well.
Perfect. So. Well, we're taking over the world. That's all I can say. That's it. How's life for you now? How have things progressed from your last diagnosis to where you are today?
I'm okay. I mean, looking back, it was the silver lining was that my eyes opened up and noticed that there was a lot more to life than sports. Mm-hmm. I'm still a major sports fan. I'm disappointed about the Colts, but I've managed to go find a different calling in life.
Yeah. And it's the advice that you would have from your perspective. A lot of parents listening right now. What would you have to say to them?
Well, looking back, as a 16, 17-year-old, you can't expect them to see the bigger picture in life. You can't expect them to say, yeah, I'm having symptoms and I shouldn't play. They're going to do whatever it takes to play. Mm-hmm. So looking back, I was insane to put myself in some of those situations. I had still had symptoms, and I told the trainer, I'm good. Mm-hmm. I put myself in situations where things could have been a lot worse.
Right.
So looking back, I really encourage parents to tell their kids, really talk to them and say, it's okay. You know, especially nowadays with all the helicopter parents involved in sports, it's okay if you don't play. Mm-hmm. So having that really goes a long way for a kid that wants to please their parents.
Yeah, I think that's a great advice. And Colts will be fine. They're going to come.
We got Andrew Luck.
Yeah, you got Andrew Luck. They're going to be okay. They're in good shape. We literally have just about a minute remaining, and for that time, I want to thank each and every one of you for your great contribution this morning and for joining us on the program. And Dr. Violet, I want to turn it over to you for just shade under a minute to kind of put a bow on it for us.
Thank you so much for listening today. We really appreciate it, and thank you to Rick for having us on. Just to give you the URL and our phone number again, www.hntrsurvey.com, 808-692-1375. We'll be happy to assist you with taking the survey and pleased to give you information and referrals for your particular situation. Thank you so much.
Much appreciation. Thanks so very much. And all of our guests today, of course, Dr. Violet Horvath. Joining us today, Dr. Robert Sloan. Also on the panel today, Dr. Matthew Koenig and Colin Whiten with a great story and also a great sports fan, which we deeply appreciate here in studio. Bottom line, though, is that your community matters. We appreciate you for joining us today. If there is something that you would like to contribute, or if you would like to join us and spread your message of how you or your organization is helping our community, don't hesitate to contact us. As a matter of fact, you can do it directly at Richard Hamada, Hamada, at iHeartMedia.com. And we'd love to have a chance to chat with you. We hope you have a wonderful day today. Many, many thanks again to our friends in studio. And as I said before, one thing is crystal clear as of today, that your community matters. We'll see you next time. We wish you aloha.